Hi everybody, welcome back. We will continue our lecture.
Oi, semua mari sini. Kau taci. Mari sini. Developer, kau pun mari sini. Cepat marilah. Berapa kali mau panggil lu orang?
There are few types of strong opioid agonists like morphine, heroin or diamorphine, methadone, fentanyl, sulfentanyl, alfentanyl, remifentanil, pentidine or meperidine. Okay, we start with morphine. Morphine interact with opioid receptor in the CNS, GIT and also urinary bladder. It can cause the hyperpolarization of nerve cell by inhibition of nerve firing, inhibition of transmitter release. This is about this slide is about the morphine action and effect on CNS, respiratory, and many other organs. I think you can read this after the class. We start with the opiate therapy use. First is for analgesia. Morphine is the first line therapy for severe pain, especially when pain and sleep needed. Diarrhea superseded by diphenhydramine and loperamide. Third is for cough. Effect achieved when side analgesic dose. It may consist codeine, Volcodeine, and dextromethorphan are more widely used. Number 4 is acute pulmonary edema, which can cause the vasodilatory effect. When the morphine is given, it can reduce the dyspnea caused by pulmonary edema with left ventricle failure. For the morphine pharmacokinetic, it can be reabsorbed from the GIT and slow erratic, and it also can undergo significant first-pass metabolism, such as by the subcutaneous, intramuscular, and intravenous, which can produce more reliable response. Duration of action about 4 to 6 hours when given systematically, and given orally as extended release provided more consistent plasma level. Okay, this is type of morphine preparation. I believe you can read this after this. Morphine rapidly enter all body tissue, including the features. Therefore, do not use analgesia during the labor. Only small percentage can cross the blood-brain barrier because it is least lipophilic among opioids. Okay. For morphine metabolism, it conjugate in the liver to a glucuronic acid. What happens here, morphine is primarily conjugated to morphine glucuronic, or known as a M3G. M3G is less active but has a neuroexcitatory properties. Next, about 10% of morphine is conjugated to morphine 6-glucuronic, or also known as a M60. M60 active metabolite with analgesic properties, which have about 4 to 6 fold of its parent compound. Morphine's metabolites are relatively hydrophilic, which have limited access to blood-brain barrier, and combination of metabolite can increase the adverse reaction, like to the patient with a renal failure, and high doses administration over long period, which can affect the high of M3G, which can induce a CNS excitation like a seizure, and also it can increase the M60, which can induce the prolonged opioid action. For morphine adverse reaction, it can cause the respiratory depression, and the contraindication must be careful in a patient with impairment respiratory function. It can cause the nausea and vomiting. It can increase the intracranial pressure. So this is quite bad for the patient with the head injury. It can cause the hypotension. It can cause the urinary retention in benign prostatic hyperplasia. And lastly, it can cause the tolerance also dependence. Okay, this diagram show the opioid withdrawal syndrome, which I hope you can go through this diagram after this. Now we move to morphine and drug interaction. Morphine can interact with the sedative and hypnotic drugs, which may cause the CNS depression and also particularly respiratory depression. Morphine also can react with other antipsychotic drugs, which can induce more sedation. Next, morphine also can react with the monoamine oxidase inhibitor or MAO inhibitors, and this may lead to the incident of the hypertension. Lastly, morphine can react with partial opioid agonists, and this may risk the diminishing analgesia and possibility of causing withdrawal syndrome.
மனசுக்குள்ள ஒரு அழகான பட்டாம்பூச்சி பறக்கிற மாதிரியே.
Now we move to the heroin. Heroin occurs by deacetylation of morphine. It also known as a dimorphine or diacetylmorphine. Potent, fast-acting, and has longer duration of action compared to morphine. And it is a lipophilic, which can cross the blood-brain barrier and cause the euphoria. And the use of it is prohibited in US, Canada, as well as Malaysia. Okay, now we move to the methadone. Methadone is a synthetic orally active opioid that is approximately equal in potency to morphine, but induce less euphoria and has longer duration of action. The mechanism of action of methadone is potent to mu receptor agonist and block the NMDA receptor and monoamine reuptake. For the therapeutic use of the methadone, it can be used as an analgesia, and also it can be used for detoxification of heroin dependence addiction. Adverse effect of the methadones, it can be the physical dependence, sedation and drowsiness, preparation. It could be from the acetone syrup and also the venestone syrup. Okay, for fentanyl, fentanyl is a synthetic opioid. It is about 100-fold analgesic potency of morphine and is used as an anesthesia and highly lipophilic, which rapidly onset but short duration action, about 15 to 30 minutes. Okay, fentanyl can be used for adjunct anesthesia, analgesia during labor, analgesia for post-operative, and also it can be used for breakdown the brain in cancer patient. Okay, for fentanyl subgroup, there are three: sufentanil, fentanyl, and also remifentanil. Sufentanil 5 to 6, 7 times more potent than fentanyl. Fentanyl less potent than fentanyl but acts more rapidly, has markedly shorter duration of action, and metabolized rapid by blood and tissue esterase, and extremely short about half-life. Okay, pantadine. Pantadine, known as meperidine in US, mechanism of action are similar to morphine except it can cause the pupil dilation. It can be like this.
பயம் வந்த மாதிரி ஒரு மார்க்கெட் ஆகும், பாடி ஸ்டிஃப் ஆகும். கிட்டத்தட்ட ஒரு சூப்பர் ஹீரோ.
Wait. Um, Pofetidine therapeutic use or indication first is for analgesia for any type of severe pain and analgesia during labor because it less effect on the uterine muscle. So I don't think you can be a superhero. Okay, for petidine pharmacokinetics, well absorbed orally but more commonly given parenterally. Duration of action about 2 to 4 hours. It is metabolized as demethylated to normeperidine in liver and excreted in urine. And it is also high concentration of norpemeridine, which can cause the seizure. Adverse effect of the pentidine is like anxiety, tremors, muscle twitch, hypotension, and also antimuscarinic side effect like a blurred vision and also dry mouth. Okay, we stop here and continue to part 3. Thank you.